I have to say that I'm very bullish on AI. This is a true revolution we are witnessing. And I keep telling that to my wife. There's a revolution going on right now.
Welcome to Small Strides, Big Business, the podcast for insurance agents who want to grow their business in a way that feels smart, sustainable, and authentic. On this podcast, we have honest conversations about better sales interactions, client service, automation, mindset, marketing, referrals, practical things that move your business forward in real life. Whether you're brand new or years into the game, so grab a notebook and let's dive into today's conversation. Hi, everyone. Thank you for joining us on Small Strides, Big Business podcast. Today, I'm excited. I have Assaf Frajman. Assaf, let me just share a little bit about you. You are currently a physician, a licensed physician who, after medical school, pivoted, and you're now in the tech world. So,
Yes.
co-founder of OctiHealth, which is a company that's dedicated to cutting medical bills and reducing out-of-pocket costs and expenses for employees, which is very near and dear to my heart because we do similar things. But just kind of an overview, as far as I understand, OctiHealth leverages AI, and you identify ways that you can save and streamline medical bill and resolution. And you have an impressive average of reducing a hospital bill 61 or a medical bill. I think we all can look back in our memory bank of bills and wish that we had met you. But yeah, tell us a little bit about yourself. I know that your journey as far as why you started this company is kind of an interesting one. So I'm going to pass it over and introduce yourself for me.
Thank you, Krystal. So thank you for having me here today. So as you said, I'm a physician by training, graduated med school, summa cum laude, but decided that I don't want to practice medicine. I started to work I started pivoting, I would say, to the tech industry while I was still a student. I have to say that I did meet my wife in med school, so it wasn't a complete waste of time, which is great.
Yeah.
But then as I said, I graduated and I've been working in startup since. I started Octi about, well, I would say 9, 10, maybe 12 months, depending on how, from where we start counting. But along with my two really great co-founders, Ori and Nadav, they are great. And as you said, we cut medical bills so far by 61%. And it all started with a friend who went to see an ophthalmologist and was billed for $9,000 for a simple office visit.
Wow.
And that's, even in US healthcare standards, seemed too much. And actually another, a relative of mine who is also an ophthalmologist reviewed the bill and found out that my friend was billed for a procedure that he didn't receive. And then just by removing this procedure, this item from the bill, his bill was cut from $9,000 to just $1,000. And that's insane. And it piqued my curiosity. So I started researching this subject of medical bills and started talking to many different stakeholders in this industry, patient advocates, brokers, just everyday normal people, patients who face this system, benefits managers, and so on. And I came to the understanding that this is a huge problem. Insured Americans, pay so much money in out-of-pocket expenses. And, this is the leading cause of bankruptcy in the US. Over 100 million Americans carry medical debts. And the key issue is there are ways to lower these medical bills, to cut them. This is what patient advocates have been doing.
Yeah.
Now, patient advocates are great, but today with the power of AI, and I know this is something that is close to your heart, AI. But today we have AI, and this is such a powerful tool, and it gives us the ability to do that, to review and lower bills on a huge scale.
Absolutely.
and with efficiency. And so, yeah,
Yeah.
that's the origin story.
Absolutely. I want to get into that more, but just something that popped in my mind as you were talking is it's not just about, I mean, there's so many facets to this. It's not just about that one bill
Hmm.
and, the payoff that that individual has, but there's I would say I was in occupational therapy forever. I've
Hmm.
had parents that have, my mom had cancer, my father had multiple medical issues, and so advocating for them, even though they were mentally competent, was still overwhelming, even though I was in the medical field. But then the second and third and fourth layer is if you are paying $9,000 for a $1,000 uh, hospital or visit, your yearly annual premiums are going to go up because your
Yes,
utilization is so high. So that's going to not just affect that one person, but it's going to affect the entire business that they work for, right?
correct. Yes, that's another thing because this affects not just you as an individual, right? But think about it, yeah, as you said, there are so many layers to this. So the first one is the very obvious financial layer. And then think about it about someone who faces critical illness and they also have to find their bank account. And then, as you said, you have your employer that have to pay, like the premiums go up. And if this employer is self-insured, the employer takes claims that are inaccurate. So it affects the patient's family, the patient's employer. And once it affects the employer, it also affects other employees because premiums are common to all of them.
Right.
So it affects uh, uh, n- well, like so many different, stakeholders and layers, as you said,
Yeah.
and just by fixing that, so you have this $9,000 bill that we reduced to just 1,000, and this is only one bill. Think
Mhm.
about, as you said, the patient who received like a big major surgery. That's a lot of money.
Absolutely. And depending on their deductible, a lot of businesses these days are only able to offer high deductible plans, or people are just taking high deductible plans because healthcare is so expensive
So it's
and then they are out of pocket that big deductible. So tell
Mhm,
us without going into all the tricks and tips or details, but how just on a general level, how
mhm,
does this work? Was somebody gives you their bill,
mhm.
and what happens behind the scenes?
So there are four key pillars to the process, and we review all of them. So the first one is billing integrity, making sure that you were billed correctly. No upcoding, duplicate charges, nothing like that. The second pillar is we make sure your coverage and an insurance policy was applied correctly. The third one is we look for, match, and apply for financial assistance plans. Those are very generous. Most Americans don't know them. Those who do don't apply, and those who apply, in many cases, don't do it properly. And then the application gets denied. And lastly, we negotiate with both providers, insurers, and so on. So what we do, we go over these four pillars and we handle the process A to Z, meaning you as the user, as the member, you do nothing. We do all the heavy lifting from the moment you onboard to the app until you received an adjusted bill. We do everything for you on your behalf.
Incredible. So tell me, if somebody has already paid their bill, is it hard to get that money back, or like when is the process ideal for you?
So the ideal timing to do that is immediately after you receive the bill, after the member received the bill,
Okay.
before the bill was paid. Because as you said, it is harder to get your money back, to get a refund. It is much harder than doing that before you paid.
All right, wonderful. Tell me about who you work with. Can an individual who's watching this and says, "Oh my goodness, I was just, or I'm about to have surgery," or whatever the story might be, along with business owners, who's ideal that you work with?
So we primarily work with employers and the brokers or consultants that work with employers. We see it primarily as an employee benefit.
Okay.
With that said, we can help individuals as well. It's not our main focus, but we can definitely do that.
Okay. Awesome. Well, we'll make sure to put all of your contact information in here for people who need it. So let's talk a little bit. Let's just switch gears a little bit to your journey, and then
Hmm.
we'll come back to the AI conversation because I know you're much more versed than I am. But I'm always really interested to talk to people who have kind of made a shift, right? So
Hmm.
I did that. I was an occupational therapist for 18 years, and now I'm in insurance. And life brings you in different
Hmm.
paths, but um the I can imagine having that conversation with your parents or maybe your wife that you were going to medical school and guess what? Now you're shifting and you're going to be in the
Hmm.
tech business world. So just kind of tell me a little bit about just that process. If there's one or two things that you think might be worth sharing with
Hmm.
somebody who might be in your position.
So I think so. First of all, let me start by saying that I really liked med school. I really enjoyed it. As I said, I graduated summa cum laude because I liked it. I enjoyed it. I've published multiple research papers. I worked as a PA while I was a student. So med school was great, to be honest. But I think that at some point I came to the realization that I didn't really fall in love with it. When you decide to be a physician, I think that's a decision that would set the course of your career for 40 years. And you have to really like it, really enjoy it, really love it. Not like it. You have to love it. And the price you pay to be a physician is very high in terms of work-life balance, emotional intensity. It's insane. And I see it with my wife. My wife works, I think, sometimes 14, 15 hours a day, and not to mention night shifts and weekends. But every day she gets back home and she is I can't even say she loves it. She comes back home excited each and every day. So it is clear she made the right choice, but
Yeah.
that choice wasn't right for me. So as I was nearing the end of med school, nearing graduation, as I said, I came to the realization I don't love it, and I started thinking, so what else can I do? And as I mentioned earlier, I was working for a startup, for a tech startup. Sorry, a health tech startup, and it kind of opened my eyes to new ideas. And I graduated and decided that I'm going to give it a year,
Okay.
and I gave it a year. I enjoyed it, and I said, I can always get back to being a physician. And they said, okay, let's do that, at least for now.
Hmm.
And I think that the issue, and you know it, right, as someone who already pivoted at some point,
Yeah.
and this is such a cliche. Sorry for that, but you really have to do something that you find appealing or you find challenging or something that you really enjoy. So I kind of followed that very simple notion, I would say.
I think that being somebody who made a pivot, I always said if I'm not enjoying it, then something's going to change. And personally, I love creating,
Mhm.
whether it's a business or a health insurance plan, like whatever the
Yeah.
creation might be. But the education piece too. I know that there's a lot of education on your behalf as well, and that's a form of creating, right? You've got to
Mhm.
figure out the best way to educate the people that you're trying to connect with. So I appreciate that. I think it's definitely um what's the word that I want? Courageous. You made a very
Mhm.
courageous choice and it obviously you're smiling here. So hopefully it was the
Yeah.
right one, but it seems like you did. As a mom myself, like, oh wow, my daughter's about to go to college. I can't imagine, 10 years from now, her telling me that we're gonna pivot, mom. So
Yeah.
yes. Well, as long as you're happy. I'm sure she's happy, you're happy.
That's correct. But it did take us some time to make peace with this.
For sure, absolutely. All right, well let's kind of finish up talking about AI because I know that AI is being integrated in every, career path and job out there in some way or another. I'm a firm believer, who knows where we're going to be in even 6 months, but never mind 6 years with AI.
Mhm.
But I think that there's absolutely, in some aspects, there's definitely a human element that AI cannot take away. I know when I was treating patients as an occupational therapist, I was getting really frustrated because the computer was kind of telling me how many visits to do and how to treat the patient,
Mhm.
and that's when I started kind of falling out of a lot of love with it. So I think that's a great example of how it was done wrong. However, there's things like bill assessment that is kind of black and white, right? So just, what are you, as you're in this world and you're in really integrating yourself into many different facets, how are you seeing AI impacting on a positive level, not just what you're doing, but kind of healthcare in general?
Hmm. Yeah, that's a great question because I have to say that I'm very bullish on AI, and I think that this is a true revolution we are witnessing. And I keep telling that to my wife, as someone who does practice medicine. There's a revolution going on right now, and AI is going to change. I think everything we know about healthcare, about the labor market in general, like what it means to I don't know, to have a job, be a broker, to be a physician, to be an entrepreneur in any kind of venture. It gives all of us superpowers. Things that used to take weeks now takes hours. The work takes hours now. And so, and as you said, I think you said it was very correct to say that we can't, like, what will happen in 6 months? We don't know. We have no idea. 6 years? Who knows, right? Things are moving in such a rapid pace. It's hard to follow. And so I personally really like AI. It was, before ChatGPT was introduced, I think it was November 2022. That was, ChatGPT 3.0, I think, or 3.5. And I started kind of playing with it
Mhm.
when it was, I think, version 2.5. And it was very stupid back then, I have to tell you. It didn't look like something that is going to change the world.
Yeah.
But here we are, right?
No, only 2 years later, not even 2 years, 3
Y
years later.
yeah,
Not even 4 years later, yeah.
just over 3 years,
Yeah.
yes, but think about it. We looked at ChatGPT back then, and I think all of us were thinking like, "Wow, this thing is unbelievable." And when we look at it now, it looks like such a crappy technology, right?
Yeah,
Because what we have today is so much powerful.
true.
So much more powerful. And so yeah, I don't know what's going to happen, but I think, as I said, I'm very bullish on AI.
Yeah. And I think that there is, whether it's just simplifying a workflow or, an AI receptionist so that you don't miss leads when they call you. Like there's so many different things that people can utilize. It doesn't have to be a multi-million dollar system, right?
Yes,
In your business.
exactly. It can do all the thing, like all these pesky tasks that you have to do as a business owner, right?
Yeah.
As you said, like you don't have to, I don't know, keep tabs on your emails, or to, like, you have this email back and forth about, like, scheduling a simple meeting. You know what it's like. You send an email, you get an email. No, the other side can't, and then you offer a few other times, and they still can. So
Yeah.
they offer, and you can't, and
No
and it
more.
takes
No more
forever.
back and forth.
Exactly, yes.
Wonderful.
So
I know it. It would be interesting. We'll have to touch base again in 2 years from today and see where we're at, and look back and see how things have changed, because it's going to be dramatic. I think that there's really two paths. Like you can kind of put your head in the sand and ignore it and hope that you can, keep moving forward, or you can embrace it on some level and utilize it. And like anything, there's responsibility to,
Mhm,
and whatnot. But yes, I'm on the path of being bullish with AI as well. So that's a
mhm,
good way to say it. Awesome. Well, Asaf, thank you so much. And this was really helpful. And I know that there's going to be some people here that want to get a hold of you. Share with everybody, your website, or if there's a way that they can connect with you on social media, LinkedIn, all that kind of
perfect.
thing.
Yeah, so I have my LinkedIn profile. That's Assaf Frajman, ASSAFFRAJMAN. I'm always happy to meet, and that's one of the great things about starting a business. You get to meet so many different people,
Yeah,
and have different perspectives. So
absolutely.
this is one of the things I truly enjoy. You can visit Octi's website. That's www.octi.health. You can send me an email. My email is octi.health. Whatever works for you, I'm fine with it. Please feel free.
We'll
And
put all that
Krystal,
below too, so we can
yeah,
put it in print.
Krystal, and I want to say again, thank you so much for your time and for this great podcast. I really enjoyed it.
I've
It was
enjoyed
truly
speaking.
great.
Thank you so much for being on. Time is the most valuable thing. So I'm super grateful for your gift of your time.
Likewise.
All
Thank
right.
you so much.
Thank you for spending time with me today on Small Strides, Big Business. I hope this conversation gave you some clarity, confidence, or one new idea to move your agency forward. If you enjoyed today's episode, make sure to follow or subscribe and share it with another agent who could benefit. I'm Krystal Small, and remember, every small stride you take today builds the foundation for long-term confidence, stability, and growth in your business.